Hey guys, hello everyone. I'm Dr. Yogita Nagpal. I'm a physiotherapist and I am a BPTH pass out from the year 2020 itself. Okay, I hope you and your family are doing well, staying home, staying safe, and taking all the necessary precautions. Today, I am here to share my knowledge with you all on a very basic topic of axis and planes. Okay. Now this is a topic which can be best explained in 3D. So I have ditched my blackboard and the PPT presentation. So I'm going to use these 3 pens: red, purple, pink. 3 pens to explain you the axis, and to my rescue are here 3 different cardboards to explain you all the planes. Okay, so basically, why do we need to learn these axes and planes? They are basically to understand movement in a better way, how they are taking place in space, to distinguish their the movements according to the space. So there are 3 axes, 3 planes. Now this is very similar to that you have learned in geometry, okay, just with different names. And these axes and planes are applied according to joints as well. But there is a term known as the cardinal planes. Now, cardinal planes are fixed planes which pass through the center of your body. They cannot be changed. So if you are using the word cardinal, it has to pass between the center of your body. Okay, so I'll explain you the axis first. Okay, so beginning with the first axis, which I'm going to show you with this pink pen. Imagine a line passing straight between the point where you apply your bindi, between 2 eyebrows, a straight line directly cutting through the head. And this, just like this is how the sagittal axis is oriented in space. This is parallel to the sagittal suture of the skull. Easy? Okay. Next one, I'm going to show you with this red pen. Now imagine a straight line passing between 2 ears. Okay. This is termed as your coronal axis. This is how it is oriented in space. This is parallel to the coronal suture of your skull. Okay. Moving on to the third one with this purple pen. Straight line. Just a straight line. This is how it is oriented in space, parallel to the line of gravity. Okay, they are all interrelated. Now let's revise them once again. Sagittal axis, perpendicular to it comes your coronal or transverse axis. Perpendicular to both of these comes your vertical axis. This is how exactly it looks. I'm turning it, they're all parallel. Okay, just like this. So this is how your axes are oriented in space. Okay, easy. Moving on to your planes, similar to your axis. Okay, now you imagined a line passing through the center. Imagine a plane passing through it, just similar. This is your orientation of sagittal plane. Sagittal plane, cardinal sagittal plane is a plane which divides your body into 2 halves, left and right. That is your sagittal plane. Next, we're going to go to coronal plane. Just a plane passing through between, instead of a straight line, an entire plane passing between your ears. Okay, this divides the body interiorly and posteriorly. So our first plane was like this. This plane is like this. Third one, this is a little different. This divides your body into upper and lower halves. A horizontal, transverse plane. Horizontal plane. This is your horizontal plane. Okay. Horizontal. Previous to this, what did we learn? This was your frontal. And in relation to this was a sagittal. Easy in 3D, you can imagine it. These are your 3 planes. Now your question is, do the movements always take place in specifically in these planes and around these axes? No, but they are very much closer to them. The exact axis and planes around which the movements takes place are learnt in biomechanics. They are actually quite related to the structure of the joint. Okay, so but there's one more thing before we move on to the examples. That is, if a movement is taking place somewhat, just like in a planar way, like a scaption, this is known as scaption. Okay, now this does not fit anywhere. So how do we term them? They are known as oblique planes first of all. So this was your coronal plane. Now this is how your movement is taking place. So this is an oblique plane. They are always termed as oblique planes. Okay, I'll give you an example of this as well. Okay, so moving on to examples now. Okay, starting with the very basic movement of elbow flexion and extension. Okay, elbow flexion and extension, easy to visualize. This was our sagittal, so I'm going to take now is a coronal. Okay, this was your coronal axis, going around the coronal axis, easy. Now the plane, sagittal plane, coronal axis. Okay, so elbow flexion and extension take place along the coronal axis and in sagittal plane. That's your first example. Moving on to the next one, we go to shoulder abduction, shoulder adduction. Okay, this was what? Our sagittal axis, the pink one. Remember? Okay, easy to imagine an axis passing through a shoulder joint, sagittal axis. Okay, now the plane, coronal plane. This is how the movement is taking place. The shoulder abduction and adduction take place along the axis, sagittal axis, and in the frontal plane. The third one, the vertical. Here, shoulder medial and lateral rotation is visible. Okay, see, taking place along this plane. One, medial lateral rotation. I hope you got the visuals. So these are your examples. Now I was talking about oblique plane. Oblique plane is scaption. So if I am doing this, so this was my abduction, adduction. Okay, so I am moving 30 degrees from that. So my movement is taking in a oblique plane which is angled at 30 degrees from your frontal plane. Okay, and the axis remains same. Okay, this is caption. This is how we term as the movement which occur in oblique planes. We term that as at an angle from these cardinal planes. Okay, this is how we give the terminology. So I hope this topic is very clear to you all. 3 axes, 3 planes, movements of the body, how to distinguish them. If you have any other doubts, you can post them in the comment section. So this will be all from me today. See you all next time. Take care, stay healthy, eat healthy, exercise daily, and please take the necessary precautions required to deal with this crisis. Thank you. Bye.